Hi everyone, were you able to guess what the topic is from the video that I showed now? Yes, I am talking about spasmodic dysphonia, and adductor spasmodic dysphonia results in a speech as if you had been strangulated while speaking. Now what do you mean by spasmodic dysphonia? By definition, it is a focal task-specific laryngeal dystonia with involuntary contractions of intrinsic laryngeal musculature. First of all, you have to know what is this focal dystonia. When there is a group of muscles acting resulting in a particular posture or movement, that is what is meant by focal dystonia. There are lots of focal dystonias you might be familiar with, like the torticollis when your neck is in a particular posture, and writer's cramp, blepharospasm where there is involuntary blinking movement as you can see here, or oromandibular dystonia. And there is another dystonia which you might have seen in this movie called Joker. He is unable to control his laughter here. This is a laughter dystonia. This laughter dystonia, I have particularly put it here because spasmodic dysphonia is one condition which can be relieved by laughter. Why is it so? I will be coming to that later on. Now, there is a syndromic complex called the Meigs syndrome, which is characterized by spasmodic dysphonia, blepharospasm, oromandibular dystonia, and sometimes even writer's cramp. Now, coming back to spasmodic dysphonia. What is spasmodic dysphonia? I told you it is a focal task-specific laryngeal dystonia affecting the intrinsic laryngeal musculature. Now, what is happening in adductor spasmodic dysphonia? What are the adductor muscles? You can see that thyroarytenoid and vocalis are the ones which deals with adduction in the anterior part of the larynx, and at the vocal process level it is the lateral cricoarytenoid which causes adduction. So in adductor spasmodic dysphonia, it is these two muscles which are getting involved. When there are prephonatory spasms, it is the thyroarytenoid muscle which is said to cause the adductor spasmodic dysphonia, and if the spasm is mid-phonatory, it is said to be due to lateral cricoarytenoid muscle. Now, what is happening in abductor spasmodic dysphonia? In abductor spasmodic dysphonia, it is the posterior cricoarytenoid muscle that is going into spasm, and because of that, what is happening? There is abduction happening, and because of that, there is phonatory gap, and that is resulting in a voice which is breathy. Now, there is one more type of laryngeal dystonia. What is happening here? In spasmodic dysphonia, it is usually in expiration while the patient is phonating that spasm occurs, right? Here what happens is that the thyroarytenoid is going into spasm during inspiration, and hence this can result in stridor in the patient. So the newer terminology is actually laryngeal dystonia. It includes adductor laryngeal dystonia, abductor laryngeal dystonia, mixed laryngeal dystonia, and the last variant, that is adductor respiratory laryngeal dystonia. Apart from all these, there is another type of dystonia, that is singer's dystonia. Here it is only in singing the patient will be having the problem with spasm. Okay, now why it is called as task specific laryngeal dystonia? Because it happens only during normal speech, and it is aggravated during telephone conversations, while going for a public speech, anxiety situations, etc. However, during laughing, okay, when you are laughing out loud like this, or while crying, the patient will be having normal voice, and even during sneezing and yawning, the patient's voice will be normal, and it can be abolished by taking alcohol. And another thing is the singing voice will be normal except for in the case of singer's laryngeal dystonia. That is another entity. Okay, so if you are going to talk in this manner, in a sing-song manner, the patient will be able to abolish the spasm. So that is why this is called as a focal task specific laryngeal dystonia. Okay, now why is it so? It is because there are two pathways for normal vocalization and for emotional vocalization, as you can see here. The second pathway, which deals with the emotional component, does not have any role in the normal conversation. It happens only during laughter, while singing, when you are talking out emotionally loud like crying, and all such actions only it will be activated. So that pathway is usually unaffected by spasmodic dysphonia. But why does it occur? What is the etiology of spasmodic dysphonia? Earlier it was thought to be due to
neurosis psychosis.
Yes, it was thought to be due to neuropsychosis, but now due to the newer functional MRI studies, there are more and more evidence regarding the neurological problem. The basal ganglia disorder was the earlier thing that was identified. Later on, loss of surrounding inhibition, abnormal plasticity of motor cortex, abnormal sensory function, all these happening in the somatosensory motor cortex area along with the association cortex, the thalamus, the cerebellum, all have been identified as the risk factors. And of course, there are reduction in certain inhibitory receptors such as GABA, and there is an increase in the activity in the direct pathway of dopamine release, whereas the indirect pathway is getting inhibited because the D2 receptors are reduced in the indirect pathway and the D1 receptors are getting increased in the D1 the direct pathway. Along with that, there is an increased dopamine release in the nigrostriatal pathway. This is what is resulting in the excess spasm. And of course, there are familial history seen in spasmodic dysphonia. Why is it? It is because of certain genes which can contribute to spasmodic dysphonia. There are multiple genes which have been identified, including DYT1, 4, 6, and there is something called the TAP1 gene mutation which is associated with spasmodic dysphonia in DYT6 type of dystonia. How will you evaluate a patient with adductor spasmodic dysphonia? You have to ask them to take a deep breath, okay, and then you have to assess until what duration the patient is able to say a ni or a sound. Okay, this is what is meant by maximum phonation duration, and this maximum phonation duration is usually prolonged in case of adductor spasmodic dysphonia until otherwise when it is very severe. In abductor spasmodic dysphonia it is reduced. Now let's see how an adductor spasmodic dysphonia patient's sound will look like. There was recently a YouTube video uploaded by the celebrity dancer Tara Kalyan. You can see the video.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Listen to her voice when she is speaking. As you can hear it, it is like strangulated while speaking, right? Along with that, there are some breaks happening which are unintentional, which is now. What are the findings when you do a flexible laryngoscopy? You will be able to appreciate the thyroarytenoid spasm, as you can see here. Another peculiar feature of adductor spasmodic dystonia is that it gets relieved on whispering. Why is it happening? It is due to the change in sensory feedback coming from the vocal fold mucosa or due to change in the subglottal pressure in the trachea. Now coming to abductor spasmodic dystonia, what is happening there? As you can see here, the patient is phonating and there is abductor spasm happening. Okay, and because of that it is a breathy voice. Along with that, another thing that you have to look for is that there is a flaring of LNAC. This flaring of LNAC was described by none other than Jaykumar sir, who is my mentor. Now coming to the video laryngoscopy finding, if you look carefully, you can see the posterior cricoarytenoid muscles are going into spasm, resulting in the phonatory gap and the breathy voice. I got these videos from Jaykumar sir himself. You can hear the voice of Jaykumar sir in the background. Whenever you see a patient with spasmodic dysphonia, you have to actually ask him or her to phonate in falsetto mode. Okay, what is falsetto mode? When the patient is phonating in falsetto mode, there is a small gap happening right between the vocal folds, and because of that, the adductor spasm will get relieved. That is what is happening in case of adductor spasmodic dysphonia, whereas this auditory feedback by closing of the ears can actually help not just adductor spasmodic dysphonia but also in abductor spasmodic dysphonia. Now, what are the differential diagnoses to be considered? Muscle tension dysphonia, especially type 2 muscle tension dysphonia, can closely mimic adductor spasmodic dysphonia. Then dysphonic voice tremor and essential voice tremor. Dysphonic voice tremor happens only during dysphonia. That is, it is also a task specific tremor, unlike essential voice tremor which is happening all the time. And this tremor, you have to look for whether it is present only in the larynx or whether it is a generalized tremor or not. So that's all about, in a brief, of the introduction of spasmodic dysphonia. I will be talking to you about the management of spasmodic dysphonia in another video. Until then, goodbye.